The clinical examination that is seen in this image depicts the clinical testing for the integrity of vestibulocochlear nerve. Vestibulocochlear nerve is not only concerned with hearing but also with maintaining the body balance. Here what we see is testing for the cochlear component or the hearing component of the vestibulocochlear nerve. In order to get a detailed understanding of the anatomical basis behind such clinical examination, let's try and learn the anatomy of the vestibulocochlear nerve. Even though the question on vestibulocochlear nerve may be relatively rare, in order to understand the anatomical basis of deafness or conduction of sound, that is the anatomy and physiology of inner ear, we must know the anatomy of vestibulocochlear nerve. Let's try to discuss the vestibulocochlear nerve under the same headings. First, we will talk about the type, the functional components, the deep origin, then superficial origin, then its course and relation, then we will talk about its branches. Since it is a sensory nerve, we will discuss this little bit differently. Then of course, the clinical anatomy associated with it. Let's begin with the type of vestibulocochlear nerve. Remember, vestibulocochlear nerve is an example for purely sensory nerve. Along with the optic nerve, oculomotor nerve, vestibulocochlear nerve is the third nerve which is considered as purely sensory. This is concerned with sensation of hearing as well as sensation of maintaining the balance of the body. Since it is a purely sensory nerve, the functional components it should have is from only the afferent column. And even in the afferent column, the vestibulocochlear nerve has its own column, own afferent column, that is special somatic afferent column. So, special somatic afferent column is concerned only with the vestibulocochlear nerve. The nuclei of the vestibulocochlear nerve or its deep origin is represented by the cochlear nucleus and then the vestibular nucleus. The two cochlear nucleus and the four vestibular nucleus, which are predominantly located in the pons and medulla, these represent the deep origin of the fibers for vestibulocochlear nerve. What about the superficial origin? Superficially, the vestibulocochlear nerve is attached to the pontomedullary junction. Medial to it lies the nervus intermedius and the motor root of facial nerve. So, this is the most lateral structure found in pontomedullary junction. So, any tumors affecting this nerve here in this region can also involve the facial nerve. So, this is regarding the superficial origin. What about the branches? Now, since this is a purely sensory nerve and concerned with two important pathways, that is the vestibular pathway and cochlear pathway, the course and relation slightly differs here. The vestibulocochlear nerve, as we said, consists of two parts, the vestibular part and the cochlear part. Initially, these two parts are separate, that is the vestibular nerve arises from the vestibular system associated with either static equilibrium or kinetic equilibrium, whereas the cochlear nerve arises from the end organs of hearing, that is the hair organs or the spiral organs of corti. So, this cochlear nerve and vestibular nerve have central processes and peripheral processes. Now, let us talk about these processes to understand the course, relation and branches of the vestibulocochlear nerve. The ganglion that is associated with hearing is called as the spiral ganglion. This spiral ganglion contains bipolar neurons with central processes and peripheral processes. The peripheral processes take their origin from the hair cells, whereas the central processes go towards the cochlear nuclei. Similar to this, we have the vestibular ganglion, which contains again these bipolar neurons, which have their peripheral processes located in the organs for static equilibrium or dynamic equilibrium or kinetic equilibrium. If we are talking about static equilibrium, these peripheral processes begin from saccule and utricle. If we are talking about kinetic equilibrium, they begin from semicircular canal. But ultimately, the central processes will reach the 4 vestibular nuclei located in the brainstem. So when the vestibular nerve receives these peripheral processes and central processes, as it progresses towards the brainstem, we have the formation of the cochlear nerve. Similarly, we have the vestibular nerve from the organs of equilibrium. So these two nerves respectively control the hearing as well as equilibrium. This is regarding a brief description of the anatomy of vestibulocochlear nerve. The vestibulocochlear nerve, they arise separately within the internal acoustic meatus. They usually get fused and then they come out of the internal acoustic meatus where it lies along with the facial nerve and the labyrinthine artery. In fact, the nervus intermedius separates the motor root of the facial nerve and the vestibulocochlear nerve. The vestibulocochlear nerve is important because this is commonly involved in acoustic neuroma, a pontomedullary junction tumor which is characterized even by the involvement of the facial nerve. Testing of the vestibulocochlear nerve is mainly done by means of 2 important tests, that is Weber's and Rinne's test. The details of Rinne's and Weber's test will be more in detail understood in the ENT modules. This is regarding a brief description of the vestibulocochlear nerve. So to quickly summarize, vestibulocochlear nerve is a purely sensory nerve. It is the 8th cranial nerve. The functional component associated with it is special somatic afferent column. This is represented by 2 important nuclei, that is vestibular group of nuclei which includes 4 subgroup and cochlear nuclei which includes 2 subgroups. The superficial origin is represented by attachment to the vestibulocochlear nerve to the pontomedullary junction as the lateral most nerve. In the pontomedullary junction, from medial to lateral, we have abducens nerve, facial nerve and then vestibulocochlear nerve. The vestibulocochlear nerve has 2 components, vestibular component and cochlear component. The vestibular component arises from the vestibular ganglion where we have neurons with 2 processes, central and peripheral. The peripheral processes begin from the organs of equilibrium, for static equilibrium from saccule and utricle, for kinetic equilibrium from the semicircular canals. Whereas the cochlear nerve is associated with the spiral ganglion which contains typical bipolar neurons with their peripheral processes beginning from the hair cells and the central processes ultimately relaying into the cochlear nuclei. This is regarding a brief description of anatomy of the vestibulocochlear nerve. That's it for this session. Thank you.